Hey you guys, my name is Jocelyn Gomez and I am a registered nurse since May of 2020. I was watching videos on here the other day about home health nursing and what it's like, and I noticed that a lot of other nurses' experience isn't really like mine. So I kind of wanted to come on here and give you guys some intel so you can see like kind of what my experiences is like, and could also be your experience, hopefully, like in the future if you want to become a home health RN. So I do pediatric home health, and I honestly really love it. I remember in nursing school, I said I was never going to work with kids. I was like, nope, it's too sad. Kids are too, like, just hard to work with. And look where I ended up. So what I'm just going to do a list of pros and cons. And then if you guys have any questions, you can just ask me in the comments and I'll reply. Or if I get a lot of questions, which I doubt it because this is my first YouTube video. But if I do somehow get a lot of questions, then I'll just make another video answering those questions. So let's get right into it. Let me take a sip. Look how cute this cup is. My patient's mom got it made for me. So sweet. Okay. So first pro is that you can make your own schedule. So I'm reading my list from my laptop right now. You can make your own schedule, and it's super, super flexible, which you don't get that if you work in a hospital or even a clinic. So literally with my agency, my home health agency, I make my own schedule. I tell them which days I want to work. I tell them how many hours I want to work. I tell them if I want to work 8-hour shifts, or if I want to work 12-hour shifts, or if I want to work 10-hour shifts. I tell them I don't want to work weekends, or I do want to work weekends. Literally, you make up your schedule how you want it, and that is honestly so amazing. Number 2 is holidays. I'm someone who, like, I have to have my holidays off. I am so family oriented. My family's always turning up for holidays. We always have something going on. So it's really nice with home health care because a lot of these parents don't really need you to come in on a holiday because they don't work also, so they'll stay home with their kid. And so if they're staying home with their kid, they don't need you to come in, then hey, I'm off on my holidays. It's freaking amazing. Of course, if you do go in, you'll get paid time and a half, which is nice. But I'd rather be at home with my family, you know? Like, duh. Who wants to work holidays? Not me. Okay, so number 3 is that you get to choose your own assignment, which I love this so much. So the way my agency does it is we do a thing called meet and greet. So your agency will kind of pair you with a family that, like, they think that you might fit in with well. And so then you go to this thing called meet and greet. You meet the patient, you meet the family, you kind of get a little bit of tour of like kind of where things are. The parents kind of give you background. They explain, you know, like what's going on with the patient and how they do things, kind of like what's their schedule throughout the day. And so with the meet and greet, you're kind of testing out if the family would be a good suit for you, and they're kind of testing out if you would be a good fit with them. So you're both testing each other, you're feeling the vibes, and sometimes it goes well and sometimes it doesn't. And for me, it was my, I think, third meet and greet. Me and the family clicked, me and the patient clicked. Like, I was like, yes, like I can see this being so amazing. And to this day, a year and a half later, I'm still with that family. I'm still with the patient. Me and that patient are like BFFs. We're so close. Love her to death. And so it's just really awesome that you get to choose your own assignment. Number 4 is that you get to build relationships with your patient and your patient's family. And this is so big because when you work in the hospital, you just treat a patient and you might never see them again, or you might see them again 2 months later when they come in. But it's just really sad because you don't really get to like know what happens to them. You know, did they get better? Did something happen? It's just the unknown. So with home health care, you're literally seeing your patient like every day or every week. You get to see them grow. You get to see them learn. You get to see them be better. You get to know their family really well. Like with my situation, I work with a now 4-year-old who I have Monday through Friday, and me and the patient's mom are literally like really close. Like, I think the patient's mom knows more about me and my life now than some of my friends do, because I literally see her every day. We talk every day, and we've just like established like a really amazing relationship. And it's just really awesome to go into work knowing that you're making an impact on this patient's family and they're making an impact on you, and you just establish this relationship that might last, who knows, forever. Okay, so next, number 5 is the autonomy that you have with home healthcare nursing. So obviously in home healthcare, you are the only healthcare professional with that patient, unless of course ST is there or PT is there, but I mean they're only there for like an hour max. But with the autonomy comes like really developing confidence in your nursing skills. You have to figure things out kind of by yourself, and there's not someone like right there that you can ask a question to. You kind of just have to like really think in your head, Google it, or quick call your case manager and ask her a question. But you really like start to get confident in your own skills because it's just you by yourself making this decisions. It's good to develop your confidence in your nursing skills, and being a home health nurse helps a lot with that. So next, number 6 is that you get to have fun on the job. At least with my experience, I have a lot of fun at my job, and I will take that any day over being stressed for 12 hours, not getting a break, not drinking my water, not like being able to take my phone calls or text people back. Like, I'm someone who really like prioritizes myself and puts myself first, because you kind of have to in this life. Like, you really gotta like be your own advocate. So what I mean by like you get to have fun on the job is, for example, I have a patient who is very mobile. So we literally like get to go to the park. We literally have days where her mom won't work, and like we'll go to the mall and we'll like spend all day at the mall, and then like go get lunch after, and like go get ice cream after. And like I'm getting paid to just literally chill. Of course, I'm still going to do my vital signs, my assessment, medications, like literally all of that, you know, that comes with nursing. But it's literally like I'm having fun. Like sometimes we'll go to the pool and I'll bring my swimsuit and I'll swim with my patient and I'll play with her, and like I'll like tan a little while she plays. Like, it's really awesome. It's a really amazing gig. And you have to keep in mind that not every assignment is like this. Obviously, my patient doesn't have a lot of limitations, so we get to do things like this. With other patients, you won't really get to do stuff like this, but you can also have your schedule set up with different patients throughout the week. So I can literally go from working Monday, Tuesday, Wednesday with the patient who we can do normal things that a kid does, and then like Thursday, Friday working with the patient who's like bed bound or wheelchair bound. But even then, like I still have fun during those shifts, because you get to take them on walks, you get to just like be outside and enjoy weather and enjoy fresh air. And when they nap, you're literally straight chilling. Like, you could be documenting, you could be reading over nursing material, going over some skills, you could be making phone calls, you could be making appointments, like whatever you need to do when that patient is napping, as long as you're still, you know, like overseeing them and making sure they're good, you can do that, and you have freedom to do that. Like, if you need to trade stocks, you can do that. And honestly, it's just really amazing. Like, I don't think I could ever work in a hospital, like now that I'm used to just like the freedom and just how non-stressful it is. And then number 7 is that it's very rewarding. If anyone ever needs help, it's definitely a parent. And if any parent ever needs help, it's definitely a parent whose child has medical conditions. So when you are working with families in their home and you're taking care of their kids, you are literally being such a huge help to those parents, and like they value and appreciate you so much. And I feel like that's not something that you feel a lot in the hospital setting. And I just know like that they're very appreciative of me. Like, I could just tell. They tell me, they treat me really awesome. They just really are thankful that you are able to come in and take care of the child and keep them safe, and you know, maybe even help out with chores. Like, when my patient's mom does my patient's laundry, I put away her clean clothes, I make her bed. Like, I just want, you become a nurse to be helpful, right? You become a nurse because you're caring and because you want to help people, and that's exactly what we're doing for these parents and for this patient. And it's just very, very rewarding. And also, I kind of get to play mom, which is really cool because I love kids. Like, I love kids so much, but I don't really want any of my own for a while. So being like, you know, with my patient, get to play mom, and it's like, I don't know, it's really fun. And like, when my shift is done, I go home to no kids, and then I go back to work the next day, and I'm like, I'm so excited to see her and just take care of her and teach her stuff. It's just really amazing. Like, it really is. Okay, so now moving on to the cons. One of the things that I started to get kind of a little bit irritated with is that your schedule is not guaranteed. And what I mean by that is parents will cancel, like, oh, I'm not going to work today, you don't need to come in today, we don't need you. And you're like, well, damn, like, I planned to come in, and that's part of my hours. And like, also with that is like, you can't really find a fill-in shift that easily in home healthcare, because in a hospital setting, it's a controlled setting. You know where the meds are, you know where the supplies are, you know where everything is, there's a system for everything. Whereas if you go to a fill-in shift with home healthcare and you've never even had this patient before, it's just like, kind of like, you're kind of freaking out. You're like, where's this? Where are the meds? Where are the supplies? Where are the emergency supplies? How do you guys do things? What's the schedule for this patient like? It's just very, like, there's a lot that you kind of have to know beforehand before you just go in a patient's home and just take care of them, because you just have no idea, like, how they do stuff. So whenever, say, like, a family calls and just is like, no, we don't need you to come in today, or like they'll call the night before, you can have the day off tomorrow. You're just like, well, shit, like, my agency isn't going to be able to find me a fill-in shift. And even if there was, like, do I really want to take that shift and then just be like clueless, not know what I'm doing? Especially if the parents aren't home and you have all these questions, like, it's just not really easy. So you kind of just have to take the L and have the day off. Sometimes it's good because you're like, oh yeah, I get a break. But for me, most of the time, I'm like, dang, like, I wanted to work, I wanted to get my hours. So that kind of sucks. Or like, even if they don't call in, but they get home early, like every day that week, you're like, dang, like, I'm missing out on 2 hours every day because you're getting home early. And so now I'm not getting my 40 hours or any overtime because I'm not getting my hours in. That kind of sucks. It's not like a very set schedule. You do get to make your own schedule, but sometimes it's not always going to work out that way. Okay, so con number 2 is that pay is generally lower than hospital pay, which I knew going into home healthcare. I was like, I'm going to be making the same amount that other new grad RNs are making in the hospital. I would rather be getting paid, maybe $3 to $5 less, and be much more happy at my job and have a great work-life balance. So if I miss out on $5 an hour, for me to have a good job and be happy at work and actually be excited to go to work and not stressed and have a good headspace at work, then I'm going to do that. Okay, next. So con number 3, picking up shifts. I already talked about picking up shifts and how that can be really hard. So next, number 4 is no coworkers, because you're literally the only healthcare professional there, unless, like I said before, ST is there or PT is there or the parents are there. But I kind of like this. Maybe it's not really a con because I just don't have the energy to always be talking to people. I don't know. I'm more of like quiet and to myself, and that's probably why I ended up in home healthcare. Like, God was like, girl, like, you don't really belong in the hospital setting. So yeah, you don't have coworkers. For some people, they might not like that. They might want the whole like coworker social setting of their job, make new friends. At first, I was kind of upset about it, but then I was like, no, my patient is literally who I talk to my whole shift, and I'm fine with that because she's so cute. Okay, so number 5 for cons is that it almost feels like the caregiver / parent, whatever you want to call it, is more in control than you are. So what I mean by this is, say in a hospital setting, you have all these different healthcare providers telling that family the same thing. The doctor, is in there talking to the family, and you kind of like just have backup in a sense. But when you are in that patient's home, you're in their home, and I don't know, it's kind of hard to explain. It's just a different dynamic, and it's just hard telling parents what to do with their kids when I'm like 23 and not even a parent, and it feels some type of way to tell like parents what to do with their kids, even though I'm a nurse. I don't know. I just don't. Sometimes it feels a little weird. But don't get me wrong, I advocate for my patient. Like, if something is wrong or something is off, like, I will tell them. And if they get mad or if it's awkward, it is what it is. But I definitely think that a lot of people don't think of home health care, like, whenever they're thinking of their options. And I really think that you should, because it's flexible. Like I said, you get to choose your own schedule. Well, at least with my agency you do, and I'm pretty sure with most home health agencies you get to choose your own schedule. You get to choose your assignment, which is like kind of a big deal. And it's just really, really rewarding. Like, nursing in general is rewarding, but I feel like home health care just has this different aspect on it where it's even more rewarding. So I really recommend, like, if you're someone who doesn't do well in like high stress environments like me. I get stressed so easily. I'm always in my head. I'm always like doubting myself. I just want to be perfect and I don't want to make mistakes. And when I'm in the hospital setting, I'm not in a good headspace. Like, I'm like doubting myself. I'm talking to myself in my head. And then I'm like, since I'm not in a good headspace, I feel like I don't make like that well decisions because I'm just so in my head about it. So I was just like, you know what, like, I am not thriving here at all. Like, I don't feel empowered. I don't feel like I'm being the best nurse I can be here in this particular setting. And with home health care, it's different. It is. And I'm not saying home health care is easier, because it can also be really stressful. I mean, you're literally the only healthcare professional there, period. So if something goes down, it's literally you're the only one. You better call 911, you better call parents, you better figure it out, but it's literally just you. I remember one time my patient was desatting, and I literally had to call 911 while I was doing my assessment, while I was trying to get patient's oxygen up, while I was trying to inform the parents of what was going on, while I was trying to inform my case manager what was going down, while I was trying to document and make sure I was also writing down vital signs. And like, it was a lot. It was very stressful. I remember after that shift, I drank. But sometimes the parents are there and you'll have backup, and you just figure it out. Same thing in the hospital, you figure it out. And what else? How do I want to end this? How do I want to end this? Come on, think. I think the last thing that I will say is just to not knock things off the list right away. Don't just judge something for what you think it is until you really do your research on it, watch videos on it, do some reading on it. Maybe even you can call up home health agencies and kind of just ask them, like, hey, I'm thinking of applying here. Can you give me a little bit of a description of what it is like for your nurses to work there? What does it look like to be an employee there, And even for me, how I had said I wasn't going to do pediatrics, look where I am now. Pediatrics. I thought the NICU was my dream. I thought, if I don't get this, I'm just, what's the point? And now I see why God literally didn't give me that job, is because I am so happy where I am now. I'm thriving. I have my weekends off. I have my holidays off. I get to establish a relationship with my patient's families. I get to take trips when I want. If I want time off, I'm getting that time off. I tell them ahead of time, and it's fine. It's good. I'm gonna get it. It's not like I'm oh shoot, what if I don't get this time off? No, I'm getting it. So sorry, I'm not trying to be cocky. That sounded kind of ugly. That was not cute. But yeah, it's just a really great work environment. And the pay isn't bad. and the higher level acuity you go, the more you get paid. But anyways, yeah, this video is probably way too long. Let me know if you have any questions. Peace out.